is clinical trials. We have a variety of clinical trials at ORSU that use oral drugs for a variety of different diagnoses. And when drug companies are, or when we have sometimes have research going on, the clinical trial may provide the oral medication for you. It can be a very attractive way to get your medication at no cost. It's also another way to get medications that are not available in the community. So if you were to go to a non-academic setting, they most likely will not have any clinical trials for your diagnosis because it is such a rare diagnosis. There also are other financial burdens too. You're taking time off work, you're traveling, you have to buy meals, you might have to get a babysitter. These are the hidden costs of cancer, and sometimes they can add up significantly. That's why Carson was talking that sometimes we will coordinate care with the local oncologist so that we can minimize some of this time off work, the transportation, and the other burdens that you have. There are some assistance with transportation, some of these other ones. The Lymphoma Research Foundation has transportation grants for CTCL. You can apply every 6 months. They'll give you $500 at a time. There are some financial requirements, but they're not terribly stringent. But you can use that for gas, parking. If you have a driver, you can take a driver out for lunch, but it can kind of ease that financial burden. Local American Cancer Societies will have gas cards. Their programs vary widely across the country, and so it's a good idea to contact them. And usually that is a going forward program rather than getting reimbursed for travel that you've already incurred. Sometimes even when we're given IV medicines, there are some needs for financial assistance. One of the ways that we do is we have drug replacement. One of the drugs that we have talked about, brentuximab, we are waiting for the FDA indication for cutaneous T-cell lymphoma. So when we have been using it, the drug company actually replaces the drug so that you're not paying for the drug. Sometimes your nausea medicine may not be covered by your insurance. And there are also good drug replacements for some of the IV nausea medicine. The most important thing to remember is that you're not alone, okay? There's a lot of people that you can reach out to in the office, and if you're not at our office, I know I talked to some of the drug reps that if there are people out there really having a hard time getting that medication for you at a cost-effective price, that I'm more than happy to share some of the tricks of the trade with them. And then when we finally get this medicine to you, we in the office are all doing a happy dance. Sometimes I talk to people at several different companies across the country and gotten the medicine for patients, and sometimes I only talk to one or two. But we are just thrilled to do that, to get you the medication. That's it. I should have talked slower. Perfect. Does anybody have any questions?
So how did you figure this out, Becky? Is this all a trial and error over the years?
This is all trial and error. I have to say that some of the people who have really led me in the right direction have been the financial specialists at Diplomat, Avella. Sometimes I will actually, if we hit a stumbling block, I will call the drug rep for the manufacturer of that specific medicine. Our social worker also has a bag of tricks too.
I'd like to make a comment. First of all, that you helped me by giving me the Patient Access Network website, and they funded one of my drugs. And secondly, it was news to me that I didn't have to use the pharmacy that my insurance said I did, and now thanks to you. I found that I could call Avella, and I didn't have to wait for the UPS man to deliver and sign, so that I spent an entire day waiting for a drug to come. And Avella is so easy to deal with, and so the fact that we don't have to use the insurance company, I mean the pharmacy our insurance company tells us, that's just such news to me.
Well, sometimes, I know with my personal insurance, they tell me Express Scripts, Express Scripts, Express Scripts, and that's the preferred pharmacy.
Right.
And Express Scripts does have a specialty pharmacy, but the customer service at the ones that I've listed is, from my perspective as a nurse, is so much different than as, and the pharmacies are very different from a normal maintenance drug to a specialty drug. You know, the way they structure their departments and the attention that they pay to customer care.
And I will say, I talked about nitrogen mustard, and I didn't mention this. If anyone's on nitrogen mustard, it has to come from the specialty pharmacies because it is shipped cold. So it actually has to come from one of those specialty pharmacies.
We have a specialty pharmacy on campus with us without some of that services, but you have me instead of the 24-hour service.
This may be specific, but if you wanted to find out the price of a drug.
You know, it used to be easier. I know that about a year and a half, we were concerned about the price of one of the drugs. So I called and talked to my pharmacy. I got a number of different pricing for different drugs for different types of lymphoma. There are quite a few number of drugs that are about $125,000, $130,000 a year for systemic lymphomas. They're all, you know, kind of in that same ballpark. They have a much bigger patient population. They have a much bigger target audience for those drugs. The ones that we tend to use sometimes are a little hot, well, actually quite a bit higher, but their target population is incredibly small compared to more systemic B-cell lymphomas.
Yeah, I was just trying, I'm on target retinal gel.
Oh, well, Dr. Music does the pricing.
I'm talking about value too, but,
Yeah.
but I'm just trying to have a 10% copay, but.
You can check GoodRx. GoodRx is a website that we use a lot for non-CTCL medicines in dermatology, that you can get an estimate of medications in your area. I have no idea if GoodRx would list something like Targretin, but that is their website. It's GOOD and then just the RX sign. But I just don't know if they list something like Targretin gel.
And are you commercial or insurance? Okay, Aetna. Are you out? Is it a supplement or is it?
No, it's
You're still working?
I'm retired.
You're retired.
I'm Bausch Mom's retired.
Okay.
Retired.
Yeah. So the copay cards.
This doesn't help.
So the question is, Medicare, the copay cards don't work if Medicare is your primary and you have a commercial secondary. But that if you truly have commercial, there may be copay cards available. I have the copay cards for Targretin pills.
Yeah.
And I can't remember if they cover all of the
Targretin
now.
They do. Yeah,
They do?
They should cover. They should.
Okay.
You can give me your address and I'll mail you one.
Okay, that'd be great. Yeah, I know. It's just that. Okay.
A lot of these things that you are going through are, pre-authorization and done beforehand. What happens if you get this bill from your insurance company afterwards? You weren't expecting, or some of the provider.
So I had that happen with a patient with Romadex, and she had a deductible for her IV treatment. And of all the people that we treat, she's kind of unique. So I really wasn't expecting that. So we got money from the Leukemia Lymphoma Foundation, and Washington University just waited on that money.
The reason I asked is totally not related to me, but it was something silly because my husband had surgery and had an injection, and they're like, oh, that's investigational or experimental, and we're not going to cover that. I'm thinking about these things, I could see where that could happen to people in this situation too. And I haven't really figured out yet what we're going to do with that, but I just in this situation, I think it could apply to people if they get something back in their insurance.
I have worked with some patients on that, some blood tests that we did that they said was investigational. I worked with the lab to kind of coordinate some of those charges. So I would go back to your surgeon and tell them, because sometimes what they label as investigational, if you appeal it, and that would be the hospital or the surgery center appealing it, you might be able to get that covered.
That's good to know, because I think it's 6 months later and you're done and you're like, cool.
Yeah. Well, and sometimes they call them now, 12 or 14 months later, and you're just totally not expecting that.
Yeah.
So, yeah.
Yeah, I have a question then about assistance. Like I just finished up light therapy for 5 months, so 3 times a week, an hour and a half each way.
Yeah.
And so, and I have to pay the copay and then my gas and loss of work, so I could have.
I would apply, I would try.
Can I still do that?
You can still do that. So through the Lymphoma Research Foundation,
Yeah.
they have online the application, and it's funded by a grant from Celgene.
Yeah, but you were saying you couldn't do it on, you have to be.
So the American Cancer Society is, some of them still do the gas cards. Those specifically,
Are for it from this point.
they go from this point forward.
PLRF, I mean, yeah, I would apply, as long as you're, I think, if I recall correctly.
As long as you're
As
still
long as
involved.
you're still in
I am.
treatment, some,
Yeah.
I encourage everybody who's on life therapy particularly to apply for the transportation grant, because if you're driving, even if you're driving, 20 minutes, you're still driving. I mean, $500 every 6 months, that's $1,000 a year,
Right.
and they're pretty, I mean,
They're not going to
They're
ask
not
you
gonna
how many
ask you
times
how
a
you
week you're
used it.
going.
yeah.
Yeah,
or-
and they're not going to, check and make sure you use it for gas.
Yeah.
Right.
It's
What
meant,
about like the copays though I pay every single time?
So the
That is
physician
right.
copays is not a very good area when there's financial help with that.
And that's something, and you might be able to speak better for it, that's known as a profession, because it doesn't just affect cutaneous lymphoma patients, it affects psoriasis patients.
Yeah.
So it's something in particular that the National Psoriasis Foundation lobbies pretty heavily for, and clearly we've been unsuccessful. But they do lobby to try to minimize co-pays on phototherapy with insurance companies in general, but I know that doesn't help your particular
Right.
situation. It is a problem as a profession that we're aware of, and we approach it, I don't know when you go, but we approach it from an access label. I realize it doesn't help you in that particular situation.
yeah, we're part of the photo, there's a coalition of organizations that are interested in specifically in phototherapy challenges.
Yeah.
So although it's been a little bit quiet of
Yeah.
late, but we're part of that coalition to help, because one of the other issues that we've run into is in the Medicare system, some of the Medicare agents will pay for a home unit, and if you live in New York, they won't.
And I just had a patient denied on Medicare.
But I'm not on Medicare.
Yeah, but there's a variety of issues around
Right.
phototherapy in general because of, it's just not seen as, it's not a drug, right? It's not,
That's a medical.
but yeah,
You know.
so it's challenging.
It might be worth, where do you get phototherapy at?
I get it at, over here at, Blue Clinic at, no, that's where my doctor is. I go over, I try to get.
So do you see
close by to
Dr.
home.
Hurley?
Dr. Hurley, yeah, I go over here to the Taylor Hospital.
Okay. So do they collect your copay every time you do the phototherapy, or every time?
Yeah.
Well, sometimes you don't get things if you don't ask. You might want to say, can I ask the office manager if you can work a deal?
You mean, I've like paid it, I've already paid all of it. But I mean,
Okay.
that was just a question to see if there's anything
I mean,
there.
the other, I hate to say this, the other thing, I don't know if you got PUVA in your band, but the other thing to think about going forward, I know you don't know how much you're gonna need light, right? Like, you don't know if you're gonna be clear for a month, a
That's
year.
Right.
But if you
It
have
happen
to,
again.
right, exactly. If you have to restart, looking at the cost of a home light unit, sometimes we can always get those approved if people live close enough to a center. If you live relatively close to the pair, it might be hard.
I don't, but it takes me an hour and a half.
But I'm looking, I know some people in this room live fairly close and have home light units.
She won't mention any names. Yeah.
Even if you live pretty close to the center, and it might be more cost effective.
Yeah. Some of the places I worked currently and in the past, there's a little discretion with some of the co-pays. So I don't know if they have any discretion with their co-pays,
Yeah.
But I have worked with people who we've waived co-pays on,
Right.
for one reason or another.
Now, the light therapy booths are only, what'd you say, $6,000? Is that that's not what how much they cost to put in your office?
So our office has a lot more bulbs. So
Yeah.
we're talking like 40 to 60
Okay.
to put in, especially like a PUVA unit.
Right.
And the ones in the office dose based on energy, whereas the ones at home just based on time.
Okay.
So they're a little bit different units, but efficacy is okay.
I figured they were because my dermatologist in Washington, Dr. Reinberg, doesn't have them. And
Yeah, well, and it's not just the unit cost, it often requires a higher level of, like a lot of times medical assistants can't use them, they have to be LPNs or RNs. So it
Okay.
requires a higher level of support staff, sometimes
Okay.
to have a unit
as well.
too.
Right.
Yeah.
Okay.
I know you were talking about drugs and assistance with that, but I noticed one of the last time when I looked at an insurance statement on, your benefits thing, there was a line on there that said there was a $1,000 penalty for no prior authorization or something. I mean, and I'm on just taking a topical now. And I have to have prior authorization to get a biopsy or something? Or what? You know what I mean?
So sometimes you do need prior authorizations for biopsies. Most of the time, that's checked like as part of the registration process.
Yeah,
But
see, and
some-
I don't know if it was just on there because, for informational purposes, or, and I know I could
And now
probably call them, but I
That's so vague, it's like, is it a hospital, is it a biopsy? So prior authorization for oral drugs, if you need a prior authorization, the pharmacy will not dispense that drug.
Right.
So they will,
But we could easily, I hate to say this, depending on how it's checked, we could easily do a biopsy without, I assume that everyone's been run through the registration system and everyone's up, but you could have not been. Like, that's definitely possible.
well, I mean, if you're just first getting diagnosed and.
Yeah, no, absolutely.
I
I mean,
don't know if it was the blood test, I guess I should call it. I don't know
that's what I would
if they
say.
even charged me for it or if it was just informational or something.
Yeah, and
because my insurance
I
is
would
so
just-
lousy, but.
I would just call the office manager. I mean, I hate to say this, that's their job. And it may be that that's the bill and that's what the bill is and it just is what it is. But
It
may-
wasn't them, it was the insurance.
It was on your insurance information.
Benefits,
Yeah, the explanation
benefits.
benefit.
Yeah.
I mean, it's still worth, that's why you get those because, well, theoretically, might go in the garbage, but theoretically you get those because that's what you're supposed to look at. So it is worth calling the office and make sure the charges were run correctly. Because, sometimes if I put alopecia, but I don't put alopecia areata when someone has hair loss, then alopecia is not covered, but alopecia areata is. And that's, a mistake on my end. So it's at least worth,
Yeah, the coding.
it
is
may
so-
be exactly right and exactly perfect, but it's always worth asking.
Yeah, the coding is so,
Right.
I knew I should have gone to school 10 years ago for coding.
well, and then they change it periodically. We had an issue with coding too, and we go back and we change the coding and then it gets paid for.
And not like committing fraud, like correcting an error.
Right,
right.
Yeah, it's using
Yeah.
a more complete diagnosis and then it gets paid for.
Because I really couldn't tell from what was on there whether they were actually counting that against me or I had to pay another $1,000 because I didn't do that because I have to pay $2,500 up front before it pays for anything. And
Yeah, and that leads me to, there's some younger people in the room. There's that new health savings account. And in the cutaneous world, I have not had that influence any patient decisions, but in the systemic lymphoma world, I've had it influence patients' decisions at this point in time to forego some testing because it's going to cost them too much out of pocket. And so that's a new twist that will be coming up and we'll be dealing with, as more people start enrolling in that.
We have an online question. It was about the light boxes. How easy is it to get a light therapy system in home? Would insurance rather cover light therapy in the home or frequent clinic visits for therapy?
So the argument we make in the letters that we write to the insurance companies is, yeah, we look at the cost. It depends on what the patient's copay is per visit, if they're required to pay a copay for every light visit versus the cost of a home unit. So those are the things that are weighed out when we submit to have a home light unit put in place. Okay. And then I don't have exact numbers, but the units run, we buy those 3-panel narrowband units generally, and somewhere in the $5,000 to $6,000 range, unless you know anything.
No, I think that's pretty standard.
Thank you.
And the light box companies are usually pretty good at helping people with getting insurance coverage if insurance will cover. And we have some situations where it's challenging. But I would also always say, keep at it. Don't let them say no. keep going.
The squeaky wheel gets the grease.
Yeah, you know, and that's, I mean, I think that's the other challenge, right? Most people, if you're not, who has time to deal with all of that? But it's the nature of the beast, sadly.
Unfortunately.
Yeah.